to answer your Facebook questions. Dr. Karen Wheeler joins us today, and one big concern this time of year is the flu. Dr. Wheeler, good to have you here. What kinds of cases are you seeing at this point about the flu?
Well, this year, so far, we haven't seen a lot of true influenza. So still more in that stage of coughs, colds, tummy viruses, and croup that the kids are getting when they're back together at school.
We put the word out on flu on Facebook, and we are getting lots of Facebook questions. In fact, let me go ahead and show you some of the Facebook questions that we're getting here. One of the questions I thought was really good. Brandy said, is the flu shot safe for infants? What, if anything, can I give my 1-year-old son to prevent a cold or a flu?
Well, the flu shot is approved down to 6 months of age. So between 6 months of age and 8 years, the children receive actually 2 flu vaccines separated by 1 month. Now, the next year that they get the flu vaccine, they only need 1. So that's the best form of protection against the flu, in addition to healthy lifestyle and hand washing.
Tina had a really good question. She says, what kinds of flu shots are safe for those with an egg allergy?
Well, now if you have an egg allergy that is limited to hives or like an urticarial reaction, then it's safe to use the flu vaccine, but I would do it in an environment where you have a healthcare provider there that's capable of dealing with an emergency.
Okay.
Also, you want to be watched for at least 30 minutes after you receive the flu vaccine. Now, if you have serious egg allergy involving blood pressure dropping, breathing problems, repeated vomiting, or a history of having to use an EpiPen in reaction to an egg, you want to work with an allergist before receiving a flu vaccine.
Very good. Barbara says there are other ways of boosting your immune system in readiness of the flu season without getting a flu shot. How about offering some alternatives as well as the traditional?
Yeah, now, well, of course, nothing is a substitute for a flu vaccine. It's always helpful to get adequate rest, to get good nutrition, normal amounts of vitamin C, and exercise, I think, help prevent just strengthening your body in general.
Why did they start recommending flu vaccine in young kids prior to recommending routine vaccination for older kids?
Yeah, so several years ago, the recommendation came out for normal 6-month-olds to 2-year-olds because they're more likely to get hospitalized and get serious complications from influenza. Then in the subsequent years, that immunization recommendation went up to age 5, and then as of 2010 went for all people.
What is the difference between the stomach flu and true influenza?
Yeah, because everybody comes in and they say, I'm getting my flu vaccine so I don't get vomiting and diarrhea. Well, really, influenza that this vaccine protects against is that one with the high fevers, 103, exceeding even the normal 3 days of fever, the sore throats, the achy body, and more of a respiratory illness than a tummy bug.
Okay, Dr. Karen Wheeler, thanks so much. We want to again thank you for sending in so many terrific Facebook questions. We'll be doing this again next Tuesday on our Ask the Pediatrician segment. The widow of Miles Brand is speaking publicly today about her husband's battle